This was an emotional day for the families. It was an emotional day for the review team, who had to listen to hours and hours and hours of absolutely harrowing evidence of harm and death that could have been avoided, of a lack of compassion and kindness. Now, the review team has demanded that the Trust here make 60 immediate changes, but also they have said that there need to be 15 immediate actions across the whole of the NHS England's maternity services. But in the end, this was very much the day for the families who have fought tirelessly to have answers. A pain shared today. The families who have grieved for the loss of their babies, for the deaths of mothers. So often they'd asked what went wrong and not heard the answer.
It's been the biggest privilege of my life, and you will remain with me forever.
Donna Ockenden is the senior midwife who has led the review into Shrewsbury and Telford NHS Trust's maternity services. And today she ensured these families were given a voice. But if anyone thought this was historic, a report into what had happened at the Trust, well, they were wrong. The independent review is shockingly clear. There are still problems.
Our final report spans the period from 2000 to 2019. However, we are deeply concerned that families continue to contact the review team in 2020 and 2021, raising concerns about the safety of maternity care they have received at the Shrewsbury and Telford Hospital NHS Trust.
Steph Hotchkiss lost her baby Sophia in 2014. Staff had failed to notice the placenta had abrupted. And yet when she went to hospital to give birth to her son last year, she claims it almost happened again.
I had to really shout for them to hear me, and it took one consultant to actually listen and overall another consultant to bring my section forward. And had that not have happened, I don't think my son would have been here today, and it would have happened again, and I wouldn't have survived it again.
Even as this report was about to be published, so in the last couple of weeks, staff were still coming forward to say that they did not believe that the maternity services at the Trust were safe. And then there were other staff who at the last minute withdrew their cooperation, so their voices are not heard in this report. Some said that they were too frightened to speak up, and others said that they'd been advised by their managers not to talk. Once again, the Trust has apologised to the families, but queried the idea the service is still not safe.
I believe our services are safe, and we have invested significantly in our services. We've employed more midwives, more consultants. We've done significant training, particularly in things like fetal monitoring and multidisciplinary training. We have got a significant culture programme. And also we have strengthened our arrangements of oversight on all the changes we're bringing about.
The findings of this report are grim. 1,486 families and 1,592 clinical incidents reviewed. About 201 babies and 9 mothers who could have or would have survived had they received better care. 498 stillbirths reviewed. About a quarter had significant or major concerns over the care given. Yet 40% of these stillbirths were never investigated. In 2009, Kate Stanton Davies died just 6 hours after she was born. Her parents, Rhiannon and Richard, were repeatedly fobbed off, but they fought back, and today's review pays tribute to them.
We wanted to know only simple answers, or answers to our questions, which was why was Kate born so poorly? Why was Rhiannon's care and Kate's care so woeful, and why were they failed so much? Kate would be 13 now, and she would be very much with us today. Her death was avoidable.
They have also learned from the report that in the 9 months before Kate's death, there were 2 other baby deaths under similar circumstances. What did you think?
A complete contrast. On the one hand, absolute pain and heartache. These babies did not need to die. The lessons to learn were right there. And on the other hand, absolute fury that this hospital trust lied and lied and lied to us over and over again to shut us up and make us go away.
At one point, Rhiannon was blamed for Kate's death, and the review says some women were actually blamed for their own deaths. The Ockenden report says the trust failed to investigate, it failed to learn and failed to improve, and therefore often failed to safeguard mothers and their babies at one of the most important times of their lives. And highlighted by the Health Secretary today, a drive for natural births at the expense of mothers who wanted C-sections but who weren't heard.
It is right that both the Royal College of Obstetricians and Gynecologists and the Royal College of Midwives have said recently that they regret their campaign for so-called normal births. It is vital that across maternity services that we focus on safe and personalised care where the voice of the mother is heard throughout.
The review describes the 4 pillars needed to provide a safe service, not just at Shrewsbury, but across England. Safe staffing levels, a properly funded and well-trained workforce, learning from incidents and listening, really listening to the families.
Well, earlier I spoke to the report's author, the senior midwife, Donna Ockenden. I began by asking her how she accounted for such a dramatic increase in the scale of the review.
What we saw was this failure to listen, failure to learn, failure for external bodies to do the right thing when they came into the trust. It was like a continuing catalogue of tragedy.
How do we know that there aren't other hospital trusts out there who've got a similarly small number of cases that could potentially mushroom?
There's been a lot of publicity, quite rightly, around our review and the growth in our review. We haven't had large numbers of parents, from across England coming forward. Having said that, we are aware of the ongoing work in East Kent, and we're very aware that there is a review unfolding and happening in Nottingham.
You're not confident enough, or perhaps you are, to rule out that there are other trusts with similar problems on that scale?
I simply can't answer that question because I don't know the answer to it. What I will say is that the attention on maternity services in England, the scrutiny on maternity services in England, is a welcome attention and scrutiny.
Are mothers and babies safe now as we speak?
A concern that I have raised with the Chief Executive of the Trust, and I've discussed extensively today, is that staff from the Trust, clinical staff on the ground delivering care at the Trust, have raised right up until yesterday that they do not feel able to speak out. They were discouraged from speaking to our review team, and that, after all this time, after all this scrutiny, is really, really worrying. So what I'm saying is that the Trust needs continuing external scrutiny, continuing external support. And what I say to the staff who came forward right up to and including yesterday is the review team heard you.
But from what you said just now about, doctors and nurses coming to you with complaints just yesterday and saying that they were discouraged from speaking to you, frankly, what trust can one have in this trust?
We've heard from a number of staff throughout the month of March, so not just yesterday, last week, 2 weeks ago, via email, via text, all kinds of messages. We've heard that from staff, and we have made sure that we have raised that with the Trust, and we have raised that with the most senior colleagues in NHS England. So that will not continue. But I agree with you, with everything that this Trust has gone through, we were deeply disappointed that staff didn't feel safe to come forward. And when they told us their reasons for not coming forward, the vast majority was saying, I'm fearful for my job, I'm fearful of being identified, I don't want the Trust to know what I've said, and I have been told, they said, not to cooperate with the Ockenden review.
Should there be individuals who face consequences as a result of this?
There was a bullying culture. They had something called a change list that, you know, if you were comfortable and working well within a clinical environment and you weren't liked, they would use the threat of sending you elsewhere as a punishment for you. Many midwives told us about that. So the culture towards families was extremely poor, but also the way that their own staff were treated was also extremely poor and unacceptable.
And are you confident that the new management is any better and has learned from past mistakes?
So the Trust made a full apology for the terrible things that have happened at the Trust over a prolonged period of time today. But I would refer again to the issues in the here and now, with staff saying very recently that they were
so
told
you're not confident
to cooperate with our review. I can't be confident the staff are able to speak out. No, I can't. I mean, the staff who've come to us have no reason, you know, to come to us and not tell the truth. So I believe the staff that are coming forward. I think it's really important to say that they've been brave in coming forward. So that is a major issue that remains in the Trust as of today.
Donna Ockenden, thank you very much indeed.
Thank you.
And if you've been affected by any of the issues in that report, do go to channel4.com/support, where you can find a range of places to seek information and, of course, help.